We're live. It says we're live.
Yeah, usually they yeah.
So I'm not going to use the clicker at all, so you'll feel a bit comfortable with us. Okay, safe to see. And keep it true. Just want to get stupid. I'm wondering what David's doing. He's apparently British or something called periscope. Has anyone heard of periscope? We have now. Apparently we have now. So you are now all periscope. There we go. Well, welcome to this session, which is part of the Future Focused Finance programme, and we're particularly today talking about our value makers, who are really important people who have come together to say that they will support Future Focused Finance in being taken forward and energised and doing work at local level in local organisations. And we asked from our value maker community for some volunteers to come and talk to you about what it's about, how it works, what it feels like, what difference it's made to them and what they've been able to do. So I'm not going to talk very much at all, you'll be really pleased to hear, because I think it's just really important that we hear from the people who are actually doing this. And then afterwards there'll be an interactive session, so we're not going to talk to you for an hour, you'll be pleased to know. There'll be an interactive session where you get the chance to have a look at some different activities that talk about money in health and how that works. But more of that later. So I'm Kathy Kennedy, and I'm called the Senior Responsible Officer, in case you're wondering what SRO stands for the value makers and for a great place to work, which is one of the action areas within Future Focused Finance. It's really great to see so many people here today. But as I say, this isn't about me talking, this is about the value makers telling you about what they've been doing. One thing I would mention is we have a tweet wall. She says I've been calling it a Twitter wall all day. A tweet wall. I don't know, is anyone in here on Twitter? As we speak, wonderful. We will encourage you to be twittering, and if you put #ValueMaker, it will appear up on the wall. And our value makers across the country are going to be watching what's happening on Periscope and through the tweet wall. So please do take the opportunity to get involved in that. So with no more ado, I shall hand over to Rebecca so that she can tell you about her experience as a value maker.
Hi everyone, so I'm Rebecca Edwards, and I'm here today to talk to you about the difference that Future Focused Finance has made to me personally. So the 18 months prior to getting involved in finance, this is definitely what day-to-day life felt for me working in finance. I put in an awful lot of effort, I really tried my hardest, but I felt like I was never really getting anywhere. Forever had this long list of actions that I had to do. I could fill 2 sides of A4 easily and never felt like I got through them. And I'm embarrassed and ashamed to say that I used to prioritise literally based on, is it due that day? Is it due for a meeting that's happening that day? Is it something that an exec's asked for? Or is it something that someone's asked for and it's been that long now that they're actually going to start badgering me on the corridor? So not the right way to do it, but definitely where I was. And at the end of that 18 months, I remember that I was just so tired out that I actually ended up handing in my notice. And when I handed in my notice to my line manager, I remember saying to him, I'm just physically and mentally tired. I just can't keep that going anymore. It was so transactional, so firefighting, that I could have been working anywhere. I could have been working for Marks and Spencer's, at the widget factory, whatever. I'd just lost that bigger picture of kind of what I was doing. Now, either fortunately or unfortunately, however you look at it, while I was working my 3 months notice, I was exposed to future focus finance and introduced to future focus finance. And what that allowed me to do was to kind of reflect back on my career and kind of what were the highlights, what had happened. And I remember thinking back to the very early days when I was a finance trainee, and I was introduced to a clinical director of renal services at Northern General Hospital in Sheffield. And he came over and he didn't introduce himself, didn't say hello, he just said to me, Rumpelstiltskin. I kind of looked and went, what do you mean? And he said, Rumpelstiltskin, if you want to get on in NHS finance, you've got to learn to be Rumpelstiltskin. You really have to learn to be able to spin straw into gold. And I have to say that on reflection, if I look back at the highlights of my career, it's definitely those Rumpelstiltskin moments. Those moments where you're working in a multi-professional team, but you've actually taken the time to go out there, find out what they do, find out what environment they work in, the pressures that they face day to day, so that when you come together as a group who's making decisions, not only can you put the finance opinion forward, but you can really listen to the opinion of the colleagues as well, so that you're making sure that you get the best value out of that finite resource that you've been given. So at the end of the day, the way that I see it, the resource that we've been given really should only spin as straw. But really, by making sure we get the best value out of it and by working closely with our clinicians, we really can deliver a gold standard service. Now, I was extremely lucky in that being introduced to FFF, I was allowed to become a value maker. I applied and said, I'm guessing I won't be allowed because I'm working 3 months notice, but if I could, that would be great. And luckily, I was allowed to become a value maker. And for me, that's just opened up this huge value maker family. These individuals all across the country who inspire you, motivate you, share their ideas, talk through the different challenges that they're facing. And all of a sudden I start to feel really inspired and really motivated by them all. And the biggest thing for me is the central team not only have worked really hard at trying to get a finance community together and get us talking to one another, but they've also tried really hard to expose us to people from other professions so that we're understanding other points of view. And for me, there's 2 real highlights on there of individuals that I've met through my dealings with FFF, and that's Tommy Whitelaw and Teresa Chin. If anybody in this room has ever heard Tommy Whitelaw speak, I'm sure that you will agree with me that if there's any person who can remind you that you should be putting the patient first and putting them at the centre of everything that you're doing, Tom is the guy to do it. And I look back now really ashamed at those 18 months where I was prioritising based on something completely different. I should have been putting my efforts into those things that were really going to make a difference, but I wasn't because I couldn't see that bigger picture. The other big inspiration for me is, as I alluded to a little earlier, I actually left the NHS about 18 months ago now, just over. And Teresa Chin is somebody who's really inspired me because she chose to become an agency nurse to give her the work-life balance that she wanted. But in doing that, she found that she didn't have the same opportunities for networking or the same opportunities for CPD. And rather than just moaning about that and just living with that, she actually did something about it. And the wee communities that she's created is just amazing. So for somebody like me who's a full-time mum, a housewife sat at home, I could, quite happily, not get involved in any of this if I wanted to, but actually there's opportunities there. Just got to be a bit more creative about how I find them, but I can still keep myself within the NHS family. So to sum up, what has been involved with NHS FFF done for me? The first side, the person on the left, is definitely me in my last 18 months of working in the NHS. That weight of responsibility that I felt on my shoulders, it was like a cloak weighing me down, and I'd like to say I walked around with my shoulders slumped. I didn't, I ran from meeting to meeting, quite honestly, always late. But what I found is, I'd turn up to meetings and I'd be unprepared because I hadn't put the time in to have ideas, to have thoughts, to have opinions. So when I got there, I didn't feel that I could really contribute. Whereas now that I've been involved with FFF and I've had that passion for the NHS and that love for the NHS almost reinvigorated within me, I feel that I'm standing a lot taller and a lot more confident. I'm sharing ideas, I'm hearing ideas from the other inspirational people within the network, and it's making me a lot more confident and feeling that I've got something that I can share with everyone. So that's all that I'm going to say about my personal journey, but there's just a slide that I want to leave you with. As you can probably imagine, being a full-time mum with a little girl who's 4, I spend an awful lot of time either watching Frozen, singing along to Frozen, acting out scenes from Frozen. But there's one line from the Trolls that I just want to share with you all today as my take-home message. I can look back, and I made some really, really bad choices in those last 18 months, and I know it's because I was stressed. I was stressed. But with FFF, I've remembered that love and that passion, the reason why I wanted to be on the graduate scheme with the NHS, not anybody else. It had to be the NHS for me. And I do think that FFS brought out my best. If I'm lucky enough to return to NHS Finance, which fingers crossed one day will happen, then I think I will return a much better person. And that's, thank you for listening to me, and I'll hand over to Mark, who's going to talk you through some of the wider benefits and opportunities.
Thank you, Rebecca. My name's Mark. I'm an internal auditor up in there. You mentioned the word internal auditor and there was these stares. It's like, oh God, there's one in the room. Have all the finances been done? Has everything been checked? I'm here to talk about the benefits of Future Focus Finance for organisations. Here to look at the benefits and opportunities taken from experience both with ourselves at Leeds and also at the Countess of Chester Hospital. From a personal point of view, when FFF came around, we'd got a brand new executive team brought in. We'd got a new chair, we'd got a new chief executive brought in to turn the hospital around. We were not in a good place. Our director of finance had been with us 20 years. He left, and we got a new director of finance in, Tony Whitfield, who wanted people to talk to him, who wanted to change things. With a finance department that were used to just doing as they were told, just running round, not voicing any concerns. With chief executives, previous chief executives, who had sat in meetings and covered their ears when they were hearing bad news. So we've wanted to move forward, and Tony Whitfield said, we're going to follow Future Focus Finance. What's it done? Future Focus Finance is not going to be a nice, neat little box that you can take back to your organisations, unpack, and it will work perfectly. It's a catalyst for change. It gives you opportunities. It gives you ideas. There are lots of pilot schemes that you can get involved in as organisations. Our start at Leeds was with the Great Place to Work pilot scheme. We undertook the survey as an entire finance staff, and the results were not good. I will be honest. But we got a point to work from. We got the opportunity to try things. We've tried the King's Fund pilot scheme and knowing the business, being linked closely with our clinical colleagues. We've been involved with the Great Place to Work enabling mobility and having secondments, and 2 people from our organisation are now going out to different parts of the NHS on secondment. So it's allowing people to develop their careers, to build the individual through one scheme. The other thing is, you can get to build a network. The Value Maker Network, Rebecca described it as a family, and it is like that. The people doing the presentation today have only spoken on the telephone. We've not been sat in a room planning this. We've spoken to each other, we've emailed each other. But it is that network that thinks, I've got hope, I've got a chance here of making things better. And the other thing that we do is we share things. The activities that we're going to try later were created in Liverpool, taken to the Countess of Chester. They were about creating that network, sharing the best practice. And as we've done all this, it's opened up the organisations. It's opened up management to being receptive to talking to people, allowing people to give it a go, to try new opportunities. So, for Leeds, we've had 2 people who have been seconded directly to Future Focus Finance in various roles. So they've been involved in the scheme and seen work that goes on further up. We've actually started to collaborate with other organisations. We've had the Department of Health come in and actually see some of our finance function, but be able to see an acute trust working. And the most revealing thing for them was we actually sent them out with the facilities team. And they actually said to me when they arrived, we don't want to really go with facilities. I said, well, that's the choice I've made for you, you're going. They got to see how patients are fed. They got to see how A&E works, how pharmacy works, how the small departments all fit together to look after a patient. And their world in the Department of Health suddenly became a lot more real as to what impact the NHS has on patients. We've links to other networks, so the HFMA network is being built up. The FSD network is being built up. People are more confident at talking. If you'd have said Leeds Teaching Hospitals 3 years ago in the Yorkshire and Humber area, they'd have gone, oh yes, well that's that organisation that sits in Leeds and you don't see them. Not anymore, we are there with a vengeance. Tony doesn't want us sat in our offices, he wants us annoying everybody else at the conferences. And he's very successful at making sure that that happens. It allows people to develop personally through secondments to organisations, through becoming value makers, taking a chance, making a change for yourself, but being supported by an entire network. And this isn't the end, this is the start of a scheme. Much more will happen. So all I can say from the end of mine is there are great opportunities ahead. It's time to join in and come with us on the journey. I'm going to hand over to Claire next.
Thank you. Okay, so I'm just here to give us a brief overview of Future Focus Finance at Liverpool CCG. We have 2 value makers. We've got myself and Matt, who's at the front here. We've also got 3 finance educators. We've got Nicola, Bill and James. Just a bit about me. I am the Assistant Programme Accountant at Liverpool CCG. I became a value maker in June 2015, and since then I've become involved in a few things. The first thing was I got the chance to interview our Chief Finance Officer Tom Jackson, who's also here at the back. Here he is. Myself and a couple of finance interns interviewed him about the Finance Director Declaration, which is just there. He signed this back in May 2014, which I hope he remembers. This was to show that Tom was willing to give us the support to promote FFF within our organisation. The second thing I got involved in was I presented at the North West FSD Student Conference. I presented in front of around 60 students about value makers and the brilliant things we've all been doing over the past year. The third thing was I also helped to organise the Show Me the Money event for the finance educators and value makers. This is our award-winning event that Liverpool CCG created to try and make finance a bit more fun and a bit more interactive. So we've just got a few photos here from the Show Me the Money event that we ran, I think it was a few months ago. We've got a couple of the games here with us today actually. We've got the pin the price on the body, the who pays, we don't have that with us today, that's for commissioning, and we've got the pie chart. You'll all get to have a go at these at the end of this session. The third thing we got involved was we were the best possible value national pilot site. This was a toolkit provided by Bain & Co. It's to aid the business case process, not to replace it. It was based on the 4 elements there, which is the what, the who, the how and the when. It allows all the staff to kind of get together in one room to gain clarity on one main decision. And it's gone down really well in our organisation, I would say, and we're trying to embed it into our day-to-day processes. The final thing I got involved in was the Great Place to Work team assessment. This was a survey taken by 3 teams within our CCG. It was basically about job satisfaction, whether they liked the job, whether they didn't like the jobs, and what they'd like to get involved in in the future. These results are currently being collated, and they're going to be reviewed by our senior managers in the CCG. So that's it from me. I'll hand over to Nicola.
Thank you. So what we've heard then is a lot about sort of what the local impacts have been from people being involved in FFF in terms of being a value maker. But what the real vision of FFF is to do is to make a national impact and to really expand this. So some of the things Claire alluded to around the best possible value tool. Caroline, who's leading on that action area, is really passionate about trying to get some of that embedded into national guidance to make all organisations look at actually, we've worked with Bill & Co, these are really good principles and we can all be more efficient and really embody the FFF principles in everything that we do if we all just take on to that. So we have got lots of motivated volunteers in our organisations across the country in terms of being value makers, and we can really use them to make a national difference. So an example would be the ISFE, which is used by all of the NHS England group at the moment. A recent survey, most respondents to that agreed that this is actually a brilliant tool for national consolidation and financial accounting. However, when we look at it for an internal reporting purpose, maybe there's some tweaks that we can do. And with the national procurement window opening soon, there's really the opportunity to get the value makers to feed into those national work programmes and really get that local knowledge impacted on the national decision making. So how are we going to do it? So here's a little map to show the spread of organisations within England that have had an FD declaration. So we've got over 200 organisations at the moment signed up, which is absolutely brilliant. However, we do have around 500 organisations in the NHS family, so we've got some way to go. So this is where we need you. So this is your call to action. So basically, if you are a CFO in the room and you've not signed up to an FD declaration, I'm sure from what you've heard today you can really start to see some of the benefits of being involved in FFF. Particularly with examples like Rebecca, where the passion had gone and really we'd started to lose our way. We've really turned that around, and sort of Rebecca's really chomping back at the bit to come back and work with us in NHS Finance, which I think is absolutely brilliant. The next thing that we'd like to do, I can see a couple of yellow lanyards in the room, which is brilliant. We are launching our next cohort of value makers in May. So you can sign up to that now. There's a waiting list if you pop onto the website. And we do want as many people to join this movement as we can. And the third thing, if you're already involved, if you've already signed the declaration, we really need to get some positive action. So what is it that we're going to do over the next year, the next 2 years, to really start making a difference and keep this movement going? There's been some brilliant work done so far, and what we don't want this to do is stop. So I'll leave you with a slide, just to remind you of that, and hand back to Kathy, and then as we say, we're going to get interactive and play some of the games that people have made for us.
Okay, thank you. As I say, I'm not going to say much today, and I think you can tell that's because we've had just a wonderful set of presentations that have told us so much about why it is so great to be a value maker yourself, or to have a value maker in your organisation who can bring this enthusiasm, bring the ideas, bring in the different things that happen across the networks. So if your organisation doesn't have a value maker, why not? Why wouldn't you want to have one? Think about yourself, think about your colleagues, and really encourage and spread the word about just how much difference it can make to an individual person and to the team and the organisation as a whole. Applications opening in May, as we've already said. Going on to the interactive session next, but just before we do that, I would just say we've talked about quite a few of the things that are happening in Future Focus Finance, but there is a stand on the 3rd floor that has much more information. We barely touched on what we're doing in this programme. We've highlighted things that the value makers have been involved in, but there's 6 different work streams. I think we've picked up maybe 3 of them, or touched on 3 of them today. So lots more going on, lots of other things for you to see, to be able to pick up, to be able to take away, and to just understand how to get involved and join in. So please do go up to the stand on the 3rd floor and have a look at that. And before we move on to the interactive session, I'm just conscious sometimes we get caught up in games and we don't have the opportunity to say thank you to people when they've gone to as much effort as these people have. So I'd just like you to thank them in the usual way. Okay then, so I'll hand over to Matt and Gavin, who are going to lead us through the next bit where we get to try some of the games.
Okay, so as Claire mentioned before, these games were originally designed by Liverpool CCG, and through the Value Maker Network they've shared them with us at Chester, and we've been able to repurpose some of these games to make them a bit more specific to our organisation. Other games are a bit more general, so can apply to any organisation, and we've got some that they've brought from Liverpool as well that are tailored more towards commissioners, and some from Chester that are more towards providers. So I think from the numbers we had on the list, it works out if you can split yourself into 3 groups of about 5 or 6 people, but we might have a few extras in the room, so the groups might be a little bit bigger. And then we'll move around the room in a clockwork fashion, and we'll have about 5 minutes on each stand, and then hopefully that should leave a little bit of time for some discussion and possibly some questions at the end. The first game is here in this corner, there's one in this alcove and one in the back window. If you just like to split yourselves up.